Hello, this video is to show you the skill of IV insertion. To begin with, we always want to verify the physician's order. Secondly, we want to introduce ourselves to the patient and explain the procedure. Identify your patient using two types of identifiers. Ensure that your patient's comfortable and that their needs are met prior to beginning your procedure. First, want to cleanse our hands and gather our supplies and place on some clean gloves. To begin with, on IV insertion, first you would want to check your patient's skin, check their veins. You kind of just want to feel around, locate the best area to start an IV. Once you've done that, you can cleanse your hands once again and place on new gloves. We'll have all of our items available. You can go ahead and open our IV kit. Some of these come with a pair of gloves in there, so you can go ahead and don those gloves. This procedure does not have to be sterile. We just need to maintain clean technique. Once you have your new gloves on, you want to go ahead and set up your area. We have our IV start kit. We have our normal saline syringe. We have our IV catheter, and you'll want to determine what size would work best. I have a 20 gauge with me at the moment, 22 gauge, 18 gauge, whatever the patient can tolerate. You'll want to get your IV extension kit, and we'll want to flush this with our normal saline, maintaining the end of that sterile. Once we've got that flushed, we can leave that sitting here and then prepare to start our IV. And you decide the area that you want to use. We have our Tegaderm to cover once we've got that inserted. We have a mini ChloraPrep, or we can also use alcohol wipes to clean the area to start if needed. You have your stabilizer, you have your tape. Always a good idea to go ahead and get that prepared prior to beginning so that you don't have to stop in the middle or risk losing your IV. Ensure that your area that you're using is clean prior to beginning. And we can go ahead and place the tourniquet on and look at the veins to ensure that we are in a good position. And I am going to go for the hand vein in this patient. We're going to place on the tourniquet. And that looks good. I'm going to go ahead and activate my cleanser and clean this area very well. Circular motion, and we're going to let that dry for just a moment. I'm going to open my IV cannula, maintaining the end of that sterile. Pop that off, ensure it's good to go. We want to ensure that the bevel is pointing upward. And now I'm ready to inform the patient that they may feel a stick. So I'm going to begin to insert this needle slowly into the vein area that I have chosen as my choice. And once I get flashback into this cannula, then I know we're in the vein. And I can go ahead and thread the tip of the cannula in, release my tourniquet. And now I will take this, and as I remove, I want to ensure we've got something to catch any extra blood that may come out, kind of occlude the vein, and remove our needle, insert our new line, and then we're going to pull back just to ensure we're in the vein. You'll see the blood there, and then we're going to flush this vein slowly to ensure that we're good. And we'll clamp that off, and we'll secure that device with our securement. And then we're going to take our tegaderm and we're going to place that over our IV cannula. I'm going to go ahead and remove this cloth, and I'm going to put this on to secure my IV site. I can remove my saline, toss my cannula into the sharks, and we'll want to secure this along the patient's arm just so they don't get it stuck on anything. You just want to make sure you have it secured to where it's not irritating or aggravating to the patient. We always date, label, and initial the IV once that is inserted. Ensure that the patient is comfortable, that all their needs are met. If there are orders for IV fluids, we would go ahead and connect those. And that is how you insert an IV. Once you are completed, you would document how the patient tolerated, the area that the cannula was placed, and what size of cannula was used for the procedure.